Now, more of the Patricia Raskin Show on WPRO. Call Patricia now at 438-WPRO or 1-800-321-WPRO. Now, here's Patricia Raskin.
Well, hello, everyone, and we are back, and I'm here with my great co-host and cohort, Tony Jones.
Great to be here, as always, on the station that reaches the beaches, and only one more week after this left for you, right?
I know.
10 years.
Oh, I know, 10 and a half.
10 and a half, jeez.
I know, and you'll be here next week.
I wasn't even old enough to drink when you came on the air. I want you to think about that for a second.
Here we go.
I was still drinking, but I wasn't old enough to drink.
Well, we have we have a big scope here. We've got millennial, and then what's the next one up for millennial?
I'm not sure. I think we have Generation Z coming up.
Okay, so Crystal just told us Zennial, and then we're flipping over to baby boomers, so we got a big span here. All right, we're going to talk more later, but we've got something really great to talk about right now. So we're talking about the Rhode Island Business Group on Health has a great program they're doing called Choosing Wisely, and we're going to hear all about that from Joanne Bilotta, Principal Senior Consultant, and Al Charbonneau, Executive Director of the Rhode Island Business Group on Health. Welcome, Joanne.
Hi, Patricia. Thank you for having us on your show.
And hi, Al.
How are you, Patricia?
Good. And meet Tony Jones, who also asks great questions.
Yeah, great to be on with you guys. I think this is a growing topic here in our state.
Absolutely. So, first of all, Joanne, can you explain what Choosing Wisely is, or however you and Al want to do this, and how the Rhode Island Business Group on Health really put this together?
Okay. First, we'll start with the history of how Choosing Wisely came to be. Choosing Wisely is a campaign that was started by the American Board of Internal Medicine Foundation, and it was as a result of a report that came out in 2012 from the Institute of Medicine of the National Academies. And in that report, it stated that 30% of the U.S. healthcare spending annually is wasted on unnecessary tests and procedures.
Wow.
And so they were very concerned about that, because if you think of the cost associated with that. Also in the report, it indicated that if the U.S. healthcare system were to, address the waste in the system, that they could help reduce the cost of healthcare. So the American Board of Internal Medicine, launched a survey. They received some grant funding from the Robert Wood Johnson Foundation, and they surveyed physicians and they also surveyed patients. So the physicians, what they discovered was that physicians felt uncomfortable saying no to patients, for fear that they would leave them for another doctor and go elsewhere. So often they felt almost a little pressured to, prescribe treatments or, medication that they knew probably wasn't necessary. And patients were afraid to ask their doctors questions. Most of us have been taught, just whatever the doctor says is what you should do.
Just trying to get through the appointment.
Although that's changed. That has changed.
Exactly. So, this whole dynamic was resulting in, excess waste and unnecessary tests and treatments. So the American Board of Internal Medicine Foundation partnered with Consumer Reports, and they launched a campaign. They put together a whole host of tools to help doctors and patients start to have the ability to have a dialogue with one another and get involved in the treatment. So it would be a joint process of decision-making.
Okay, and Al, I'm going to switch to you. And how has this been working out?
Well, as a campaign, it's interesting. In the last 5 years, what's happened at the international level is that Choosing Wisely has been adopted by many countries. There's a Choosing Wisely Canada, or Choosing Wisely New Zealand, or Choosing Wisely Australia. It's actually morphed into a worldwide movement, because the problem of waste in healthcare systems is a kind of a worldwide problem, although probably a lot worse here in the United States than elsewhere. What got Rhode Island Business Group on Health interested in this is because employers are concerned about the waste in the healthcare system, they're concerned about cost, and they're concerned about quality of services that they purchase for their employees. So this was a very natural fit to a lot of the wellness activities that local businesses have been carrying on for a number of years. And the rollout has actually been very successful, frankly. We and Joanne will probably mention this, but we've gotten support from the Rhode Island Foundation now twice to help fund the rollout of this, and the number of companies that have adopted it continues to grow. The number of participants, providers in the program also continues to grow.
Okay, Tony?
Al, talk a little bit about the rollout of this campaign and kind of, how you've been getting the word out there and how the reception has been. And, for the early adopters, how's it gone with them? Yeah,
either you or Joanne, either one or both.
Sure, yeah.
Yeah, I can speak a little bit about the rollout. We have been very successful in getting physician groups to start to accept Choosing Wisely, and Coastal Medical is one of the largest practices in the state. They have incorporated it into their patient practice so that as new patients come in, they're handing out the materials and the cards and encouraging their patients to ask what Choosing Wisely has developed is 5 questions, and those questions consist of, what are my options, what are the risks, how much does this cost, and will my insurance pay for it? So those questions are starting to get a dialogue going between their doctors. We've also been rolling it out with municipalities, with employer groups, and other consumer groups as well, and getting them to use the materials, and especially the 5-question cards, so that when patients go in to see their doctor, they have the cards with them, and they can start to feel more comfortable asking the doctor those questions when they're, talking about their treatment.
Anything else Al to add to that?
We kicked off Choosing Wisely in 2016 in June with an event at Brown University. In fact, the governor declared the state of Rhode Island a Choosing Wisely state.
Oh, that's great.
The early adopters with the program were Amica and Brown, the city of Providence, but now we have the state of Rhode Island, Washington Trust, Beacon Mutual, Blue Cross Blue Shield, Tufts United, Electric Boat, FM Global, and the program has been endorsed by the medical
Full house.
So we continue to roll out. Now, Joanne will be working as the campaign manager, so that it's even raising our expectations of what we'll accomplish in the next year.
So the overall goal, and I'd love for both of you to say, it sounds like the overall goal is to reduce, excessive costs, correct?
Cost and waste and reduce harm to patients. Remember that when a patient gets an unnecessary test,
right,
they run the risk of having a complication, which then has to be treated. So it's not just cost. It's cost, waste, unnecessary procedures. Don't use the system unless your doctor recommends that you have to.
Right. The other issue, too, that happens, and we see this with the opioid crisis that we're facing right now, is that many times patients aren't asking their options or alternatives for prescription pain medication. And so, by having this, the Choosing Wisely initiative is designed to kind of help patients have that dialogue so that they're making they may make a different decision for how they deal with their pain.
So is this for the public? I mean, does this have to come through a company? If someone's listening to this show who's a consumer, how do they find out more and get to be part of this?
The way they would find out more is they can go to the RIBGH website at ribgh.org, or go to the Choosing Wisely website, which is choosingwisely.com. And we're also offering to large organizations, employers, consumer advocacy groups, senior centers, anyone who would like me to come out and do a presentation on Choosing Wisely and help them access these materials. I'm happy to do that, and they just need to contact me at jbilotta.ribgh@gmail.com.
And we're kind of looking through the website here, and there's a wealth of information on the site itself. Talk a little bit about, just kind of perusing the site if someone just has a general interest in finding out more.
If they have a general interest, if they go to the choosingwisely.com website, there's a whole host of over 400 different topics.
Yeah.
So depending on if you want to know more about, knee surgery and your options, you can search in their search engine, and it will bring up materials that you can print down. All of this is free. and they're all online, so you can go in and choose your topic and just print it down and have it ready for when you want to go visit with your doctor or just to read up on different, different types of treatment available. Mm-hmm. They're all evidence-based.
Go ahead,
Al.
Go ahead.
Oh, I'm sorry.
Go ahead. I was just going to say, I've been working with this now for over 2 years. I am amazed at the amount of information that has been put together for the benefit of the general public. It's incredible.
Have you seen waste and costs go down as a result?
Actually, there were a couple of groups that have demonstrated results that they've seen. Dartmouth-Hitchcock Pre-Op Clinic had shared some information with ABIMF that they showed a reduction in unnecessary testing rates from 23% down to 4% within 2 months of implementation of this program.
Isn't that great, huh?
And there are a bunch of organizations that have reported in the medical literature similar results. There's an organization in Boston called the Lown Institute, which Dr. Fine, the former health department director here in Rhode Island, is on the board, and they've focused on the idea of reducing waste using the choosing wisely metrics.
Right. We've got about a minute left. What do you both see for the future of this? What's the overall? Where do you see this going?
We hope that companies and consumers of healthcare start to incorporate this as a regular practice when they go to visit the doctor, and that they're starting to make more informed healthcare decisions that are better for their health as well as better for everyone's bottom line.
So both the doctor and the consumer have to be informed, right? Both of them.
Absolutely.
Yes.
Right.
Absolutely.
Yeah. Al, your comments about where you're going in the future?
Well, I think that Joanne hit it. I just really we were very pleased when the governor agreed to declare Rhode Island a choosing wisely state, and what I would like to see in the next couple of years is that becomes totally, completely evident.
Mm-hmm. Wonderful. And again, people can go to choosingwisely.com. And if the doctor doesn't have this kind of program, can the patient go in and say, look, I saw this online and I'd like you to do this?
Absolutely. That's exactly what we want. We want them to bring those 5-question cards with them, whether the doctor is we're hoping doctors will all adopt this throughout the state. But any patient can go in with that card, and ask those questions.
Okay.
Remember, though, one closing point that the Rhode Island Medical Society did participate in endorsing Choosing Wisely when we rolled it out. So there are a lot of physicians in Rhode Island who may not be totally involved in the program yet, but know about it and would be willing to participate.
Wonderful.
I mean, it seems like it's a win on all sides. I think not too long ago I had to have an MRI, and it was not the most pleasant experience, and I can't imagine having to go through that experience and not have it be absolutely 120% needed, because it was awful.
Yeah.
Right. And there's materials up on the Choosing Wisely website about when you need an MRI and when you don't.
Oh, good. All right. Joanne Bilotta, again, thank you so much. And Al Charbonneau. Joanne is the Principal Senior Consultant for the Choosing Wisely program at the Rhode Island Business Group on Health, and Al Charbonneau is the Executive Director of the Rhode Island Business Group on Health. Log on to choosingwisely.com. Al and Joanne, thank you so much for being on the program.
Well, thank you for having us, Patricia.
Thank you.
Good stuff.
Bye. It's great stuff. All right, we're going to take a break, and then you got Tony and me in the last segment for today, and we're going to talk about podcasts and things going on and events, and so stay tuned. You're listening to The Patricia Raskin Show, and I'm here with Tony Jones on News Talk 630 and 99.7 FM WPRO. We're the voice of Southern New England.